IV therapy can be so amazing for so many reasons. If you're feeling sick and you need a little immunity booster, if you are about to run a marathon or you did run a marathon and you want some recovery, you want to get all those B vitamins back in you. There's some very specific reasons for getting IVs besides being in the hospital. So we do hydrogen peroxide for things that kind of hide in the corner, like Lyme and Epstein-Barr, some molds. We do high dose vitamin C, and that is usually for people that are doing some sort of cancer therapy. So it does help the chemo work, and it also mitigates some of the side effects. And then we do high dose NAD, which NAD is a molecule that's made in our body that cleans our oxidative paths. And so it just kind of gets everything cleaned out. Everything is working better, moving through your body. NAD is absolutely amazing. And then we just have lots and lots of vitamins. And, we are not unique in this. So there are IV centers all over the country. And so some things, if you're going in to get an IV, like what should you be looking for? So if you have never been in this facility before, you should definitely be talking to some sort of provider who asks you some health questions. So there are some reasons that IV therapy may not be the best thing for you. So if you are on dialysis, for instance, or you have heart failure, if you have an allergy to anything that is in there, if you have any sorts of, there's specific liver issues that maybe a lot of B vitamins are going to make worse. So, it's very important that wherever you go, you are talking to a provider and they're asking you some health questions just to make sure that the therapy that you're picking is a good one for you. And then also being aware that if you are doing specialized IVs, so like the ones I mentioned, the hydrogen peroxide, vitamin C, and NAD to a certain degree, these need to be done in series. So having like one of them is usually not going to give you a great deal of benefit. You need to actually have more of those. So, if you travel a lot, we have a lot of patients that travel, so they get their NAD all over the world, and that's fine. With high dose vitamin C, there is a very specific lab that needs to be done prior to getting anything over 25 grams of vitamin C. And so just, knowing that you are someplace where they are taking care of your health, watching over you, making sure that you're nice and safe. Of course, the facility would be clean and they're doing everything sterilely. One assumes that anybody doing IVs is going to have at least those basic things for patients. So, and then here, we want you to have an amazing experience. So when you come in, usually it's Nurse Cindy putting in your IV and mixing your bag. And then we get you settled in the IV room where you get tea. We have little gold eye masks. You can just totally just bliss out for an hour and a half, 2 hours, however long your IV is going for, and get all the amazing benefits, the energy, the recovery, the immune boosting, the skin. We have a weight loss one. We have so many different formulations, and I am always excited to get IVs. So I hope that if you have any other questions, drop them below. Let me know what you want to know.